Would you take half of a Tylenol or half of an antibiotic dose of medication, and expect to get the same results as taking the full thing? Same thing applies when it comes to your PRP. Hi, I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. I want to talk about why we have a hematology analyzer, a device that counts cell counts, and why that's so important as it applies to PRP, regenerative injections. So, what we do is when we draw your blood, we concentrate your platelets that we're re-injecting into areas of damaged tissue. And the newest research is telling us that the number of platelets being injected into a specific area is related to the outcome, essentially directly. So, what's really important about having one in office is that we can real time test those platelet counts and see where your starting levels are. We can do some calculations and make sure that when we draw your blood that we're getting enough platelets to then later be concentrated and injected into the areas of damage. The other cool part is that if I make my PRP and it comes back with a low number and I know, okay, the research says I need 5 billion or 10 billion here and I'm looking at, 3, 4 billion, I can go and just draw some more blood, concentrate some more PRP, and then proceed with the procedure. So that way, real time that day, we're getting an adequate and effective treatment for you. This is something that not a lot of practices do. They go based on general calculations, and something that I think is integral and important to our practice. And if you're seeking care as well, to ask your doc if they're doing the same.